We'll call to order our January 29th meeting of the Board of Health. It is 12:30 on the nose right now. I think we're going to change just slightly how we do our roll call. Instead of going around the room, I'm just going to look to Ann to verify that we have a quorum, and we can move forward from there. So,
we have a quorum of 8.
okay, very good. Thank you so much. And so that's the way we'll just do it from now on, just to help save a couple of minutes. We don't have any written public comment received. Is there anybody signed up to speak? Nobody signed up. Okay, very good. All right, well, we will move to board reports, chair report. I really don't have a whole lot to report at this time, so I won't take up a lot of time on that. Are there any committee reports to be given?
I can do a transition committee update, but we'll be, so we've had, gosh, seems like a lot of transition committee meetings, and this is the committee that's looking to vet candidates and create a good process for hiring our new administrative officer. And so we've had several committee meetings. We've started online interviews of some candidates, and we'll complete those this Friday. And we're hoping to bring forth some good candidates for final interviews by the board. And so later on the agenda today, we have some recommendations, and one of those is we don't think we need to continue with to have a contract with a firm to help us. We're doing really well, so we'll talk about that later. And also I'll have some, I'm looking for on C, item 7C, we have a proposed schedule of how the day would go for the in-person interviews. And there's a few things some to-dos that we'll have for the board with giving feedback on interview questions and also stakeholders who might be involved in the stakeholder panel. So we'll talk about that later today. So thanks.
Very good. We don't have Commissioner Cooney. Is there a finance committee update at all? No, and really nothing to report on the policy. And we'll be taking up the federal legislative agenda here in our action items. So we will move on to our consent agenda. Is there a motion to adopt the consent agenda as presented?
So moved.
Second.
Motion and a second. Any discussion? Hearing none, all in, oh, please.
On the PFAS Navigator, I just want to thank Dr. Velasquez for working with Commissioner French on the PFAS task force. Really appreciative of your leadership on that, so thank you.
Okay, anything else? All right, all in favor of the motion to adopt the consent agenda as presented, say aye.
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 Any opposed, abstaining? Okay, that is approved. And then I guess the intention is that we go into executive session right now, correct?
As far as I know.
Okay,
Yeah.
then why don't we do that? So why don't I turn it over to Michelle to share the reasonings that we'll be entering executive session.
All right, the board will be in executive session for approximately 30 minutes for litigation, potential litigation or enforcement actions pursuant to RCW 4230-110-1I, and then also to discuss collective bargaining negotiations pursuant to RCW 4230-140 sub 4. And correct me if I'm wrong, but we'll need board members, legal counsel, Rayburn, Kim Kramars.
Okay, well, if everybody else could exit while we are going to executive session, do we know how long we are anticipating?
30 minutes, I think.
30 minutes, okay. So we will, let's see, it's 12:35. It'll probably take us a minute to clear the room. So we will say we'll come back at 1:06. Okay, well, we are, our executive session's concluded, and so we will head back into our open board meeting. And we're moving into number 7, action items. Just to clarify, no actions being taken as a result of executive session. But for action items, we'll start with A, adopting a 2026 Board of Health meeting schedule and revised meeting duration. Is there somebody wants to give us a quick overview of the change? Is it just moving to 3 o'clock and adding an additional month? Yeah.
You can go, Amber.
Oh, I was just gonna say, in the executive committee, we discussed that this year we've struggled a bit with, last year, we generally went over almost every meeting despite the best intentions. And then this year, we've had to scramble to do special meetings because things come up and you can't always wait a month. And so the recommendation was to add back an August meeting. I think in the past we had, was it July or August we took off? Can't remember.
It was August and November.
Right. So we're suggesting adding back, we can always cancel a meeting, but adding back another meeting and then changing the expectation of board members to expect that meetings will likely go till 3 p.m. And if we get done early, we get done early. But that was that the discussion as I remember it?
Yeah, no, that's it. I do recall, and I just wanted to raise this, that there has been at least one meeting a year that conflicts, I think with STA perhaps, or another board. Do we know if any of these fall into that at this time?
I don't remember what month that is. I'm thinking it probably has something to do where there's maybe 5 Thursdays
Yeah.
in the and I don't remember what, but there is always
Okay.
one month where they do fall on the same month. I think it's in the summer sometime.
I think so too.
Can't recall what it is, but I also did want to highlight, I think it's usually September. We usually do a later start time because that, at least the last several years, has conflicted with the state of the county address. I think that's September. I haven't seen the state of the county advertised yet, but I think the last 2-3 years it's been September's. So we usually, instead of starting at 12:30, we start at like 1:30. So, but just, I wouldn't do that yet because I don't think there's a guarantee it's going to fall on the same day, but the last 2-3 years it has.
Okay.
So
All
I
right.
just want to highlight that maybe.
Any other, yes, Dr.
Yeah, just another consideration is the board is bigger now, and so there may be more discussion. Takes a little bit more time to allow for full
Very true.
time.
Okay. Yeah, go ahead.
Just wanted to, I'm a new member. I haven't been to that many meetings, but personally for me, it's a little easier to plan for a little bit longer meeting if that's what it really takes, rather than to kind of hang around if we're running behind. So, but I just wanted to see if the kind of community members agreed with that because I know it's a little challenging schedule-wise sometimes. So happy if others have input.
Yeah, I know that we have frequently, especially with longer executive session discussions, run into issues where we go beyond the 2:30. And I know sometimes I've got a conflict. I have to leave early, others the same. And so trying to just at least plan for that ahead. So, okay. Is there a motion to adopt the proposed meeting schedule and meeting duration?
Move to adopt the proposed meeting schedule for 2026.
I'll second it.
Okay. Got a motion to adopt the proposed schedule under action item A. Is there any further discussion? Seeing none, all in favor, say aye.
Aye.
Any opposed? Abstaining? Okay. Motion carries. Moving into Board of Health's Transition Committee's recommendation to postpone entering into an agreement with a recruitment firm to recruit candidates for the SRHD Administrative Officer position. Commissioner Waldron.
So this is just following up with the approach that we all agreed to back in December, that if we did not need, we did do a request for qualifications. The committee did look and make some recommendations on, ranking the firms, but we decided to hold on that and see what field of candidates applied in January. And the recommendation of the transition committee is that we don't feel we need to enter into a contract. We have a good field of candidates that we are doing preliminary Zoom interviews with right now, and we're hoping to give you the full board some finalists that are highly qualified. So the recommendation is that to move that we postpone entering into an agreement with a recruitment firm.
Okay. Is that the motion to move forward with adopting?
I'll make it into a motion. So
All right.
moved.
We have a motion. Is there a second?
Second.
All right. Is there any further discussion or questions related to this? Not seeing any? Okay.
One comment, just thanks to all the transition committee members. There's a lot going on. So thanks to everyone going to those and helping with that process.
Lots of meetings. Okay, well, with that, if for everybody in support of the motion to approve the recommendation, please say aye.
Aye.
Any opposed? Abstaining? Okay, that carries. Okay, and then we're going to move into 7C, proposed SRHD Administrative Officer interview schedule.
So the transition committee met and we discussed several things. And one of those was how we'd want to do our format for interviews in person with our finalists on, I think it's February 19th. Is that correct, Ann? Okay, February 19th. So it's a Thursday. And we looked at the interview format, several different interview day and a half, different formats. And where we came down was we felt like this proposed format that you can see is an all-day affair, but we get it done in one day. And it basically mimics the last AO interview process from like 3 years ago. And so we form 3 panels. So there's Board of Health members, that's us. The candidates would meet with the executive leadership team members, and then they would also be interviewed by a group of community stakeholders. So this is assuming this format works when you have 3 candidates or less. If we end up with 4 finalists, we might have to adjust. But this works for 3 or less finalists, because basically as one is meeting with one committee, one's meeting with another, and one's meeting with another. And so that keeps the day going. And then for SRHD staff and managers, there's a lunchtime kind of 1 hour meet and greet. So like maybe in this space where staff and managers come in, check in, get to meet the finalists, ask some questions in a very casual kind of setting. And then each of these committees, well, obviously we will be interviewing and taking our own notes as Board of Health members, but we will receive feedback from the executive leadership team members from their interviews. We'll receive feedback from the community stakeholders. We'd also receive feedback from any staff or managers that come in. They fill out a little survey that they can on their way out. And so we'll get that feedback as well. So all of that data will come to us by the end of the day. And the interviews would be held in exec session. That's how we did them before. And this is a question for the board. Last time, the finalists were asked they were given a question or I think they were basically said, what would your first 90 days, what could you accomplish? And they actually gave us a presentation. So they had the question in advance or questions so they could really prepare like a presentation they could have PowerPoint slides, whatever they wanted to present. So that's an option, and then we could do some follow-up questions as board members, or we could just do questions we don't have to ask for a presentation, but that's where I wanted to come back. The committee wanted to come back and get your thoughts on how much do we want them to create in terms of a presentation. I think it's good to allow them to prepare something because then you can see how they present, but it probably doesn't have to be like a 30-minute presentation. It could be 15 minutes or less, and then we give time for this to ask each candidate the same questions that we would ask the other candidates. So that's feedback with that, where the transition committee is kind of looking for your feedback on that piece. Let me just finish up and then I'll get that feedback. So then the recommendation is to have a couple leadership team members or managers facilitate, so internal staff that would facilitate the other two panels. And then, collect that data and get it back to us. And then we could put on our agenda that we could take action at the end of the day. If we felt like, we put that on potential action, if we wanted to take a vote that day to, make an offer to a particular candidate. We may have further questions and we may not want to take an action that day, but we'd put it on the agenda just so that we could, right, if we wanted to. So that's what the day is proposed to look like. So looking for your feedback, especially on how do we want the interviewees to be prepared to present to us. So feel free to ask questions or give input.
Please do. And I will just note that I think there were some, nothing firm, but some suggested community stakeholders, and I've just encouraged that we try to broaden and diversify that as much as possible, even if it means expanding that just a bit to accommodate that.
Yes, I'll make a note on that at the very end about getting your input into who you think should be invited to be on the community stakeholder panel. So we'll circle back on that. But looking for feedback on a presentation versus Q&A or both. And then we have some draft topics or questions that I can pass these around, but I think we'll be wanting you to give some ideas for what those questions would be, but we have like a starter list that we can start with. So thoughts?
Input. And really we're approving not just the schedule, but the format really as well, correct?
Right. Today we're just trying to get approval of the format, and then the to-dos, the homework for the board is giving feedback on a list of questions or presentation topics, and then also stakeholders that we would want to invite to be on the stakeholder panel. And Anne's already asked internally at the district here who are some stakeholder organizations that we could invite. So we're going to have a short list, and those who also participated last time to send out. So we don't have everyone maybe saying the same names, but so homework after this meeting will be feedback on the questions, presentation topics, and stakeholders to invite. But I would love to get some feedback on how you'd like the folks that we're going to interview prepared. Do we want them to give us a presentation, or do we just want to do Q&A?
Go around the room, Commissioner.
Just to clarify, there'd be 3 panels. Does that mean that each applicant would do 3 interviews with different groups?
Yes.
Okay. I like the idea of a presentation. I'd love if anybody was a part of that last time and has feedback on it. I'd be open to that, but I like that concept.
I was part of that last time. I did like the presentation. I don't think that the presentation needs to be as long as what we had it. I believe the presentation was a 30-minute presentation, was it? Like we gave them 30 minutes with slides and all that.
Yeah.
Right?
So originally it was last time we had 90 minutes.
Yeah.
Because we gave them a half an hour to present, and then we asked questions, up to an hour. But this time we're suggesting to make that an hour for each candidate, and so maybe a shorter presentation, and then is that what that's what I'm thinking.
My suggestion is keep the presentation, drop it down to 15 instead of 30, and go from there.
Okay. More efficient. Any other thoughts in terms of the format, schedule? I assume the board members who are not on the transition committee would like to participate. Obviously, the citizen positions are subject to the process for appointment there, and so we may not have all that information, but otherwise.
I assume the 19th is probably locked in, because I know that's the day we've got a workshop and board meeting for STAs. We've got,
Oh, do we?
we have like 4 hours of STA scheduled that same day.
Jeez. I don't think I realized that.
Workshop and then the board meeting following it for STA on that day. But
I think thought this was on the calendar first. Come on, STA.
STA's been on there since the beginning of the year, so.
Yeah, I don't know how movable this would be, so. May just have to be absent from STA that
We'll
day.
just, yeah.
Okay, other thoughts? Okay, well, if not, then is there a motion to approve as presented? Do we want the caveat of a shorter presentation to be amended as an amendment?
I think that makes sense in my mind. I mean, keep it, but shorter. Yeah, 15 minutes. And I mean, I'm trying to remember back when we did this a few years ago. I think there was a lot of kind of mulling around, waiting in between people. I mean, because when you do 90 minutes for an interview, that's a really long time. I think the interviews were pretty done before that 90 minutes, and we were, if I remember correctly, I think we were just trying to kill time before the next person came in. So.
Mr. Chair.
Yeah. please.
So originally, yes, so last time it said 90, but now it says interviews last 1 hour with each panel. So we did, this is accurate for a 60-minute with each. So I don't think we have to make an amendment to what's presented, correct? You had taken the 90 and put it down to 60.
That's
Yeah,
correct.
okay.
Well, but I think what Charlie was saying, if we're going to tell them to make a presentation to us, tell them to tailor it to 15 minutes. So they
Do we
know
want to say
that.
up to 1 hour? Just to have flexibility on.
That's
format?
fine. I mean, if we're ahead of schedule, I mean, I think it's better to cut them loose so they can get a bathroom break or grab a snack before the next, go into either the stakeholders or, rather than just to stretch it out for the point of stretching it out to get to the hour.
So if we just say up to, then the transition committee can just figure it out.
I think so.
Exactly. Yeah, 15-minute presentation, 45 minutes of questions, and a lot of these, some will go all 45, some will just go 30 minutes, and it could be up to an hour. And you can head out if you want to.
Perfect.
Well, I'll make,
Oh.
you're gonna make those. Go ahead.
Okay. Mr. Chair,
Yes, please.
I'll make a motion to approve the item as presented with an amendment that each interview would be up to 1 hour to include a 15-minute presentation.
I second that.
Motion and a second. Any further discussion? Seeing none, all in favor, say aye.
Aye.
Any opposed, abstaining? All right, that is moving forward.
Mr. Chair. So Anne will send out, we talked yesterday or the day before, I don't know, we've talked every day. Anne will send out a list of proposed, I think we should just focus on the topics for the presentation. And then I think you can trust the transition committee to come up with the other questions, but I think what we really need feedback on, what is the presentation topic that we want? Is it first 90-day priorities? What would you do in the first 90 days? Like we'll give you some suggested presentation topics, and then we'll also give a list of all the stakeholders that we have right now, the stakeholder groups from the community. So please vote on or add presentation topics. And Anne, you want that back by Wednesday next week? That's the preference?
That's the preference. Close of business, February 4th.
Okay, so look for that tomorrow. Give your input, vote on different things, give names and contact information if you have it for community stakeholders and groups that you think should be part of that panel. Okay, thanks.
All right. Well, next we've got approval of resolution 26-01, which is our federal legislative agenda. I'll thank Commissioner Waldron for pushing hard to make this happen and to be a reality. I think this has gone through a couple minor revisions over the last, 2 months, give or take, in terms of the policy committee's work and staff feedback, and we're not going to go too deep into it, but I'll just mention what the headlines are for folks who might be watching the meeting. So number 1 is maintaining stability in public health funding and foundational services. Number 2 is ensuring, and there's a number of bullets under this. Number 2 is ensuring coordinated behavioral health leadership. And then the third is investment in upstream prevention, environmental cleanup, and data modernization. And so if there's any questions, we can do our best to try to respond to those. But otherwise, I think most board members have seen this. And so if there's a motion to adopt, we'd be looking for that.
I would move to adopt the federal legislative agenda.
Great. That's a motion. Is there a
Second.
Okay, motion and a second. Commissioner.
I just want to thank Councilmember Cathcart because you added some important items in the third section around data as well as disease tracking and other things, especially with our rural parts of our county. So I think it's a really good agenda that's consistent with what the county has also adopted. So thanks to the committee for their work on it.
Yeah, absolutely. Further comments or questions? Seeing none, all in favor then of the motion to adopt 26-01, our federal legislative agenda, please say aye.
Aye.
Any opposed, abstaining? Okay, that is approved. And then our last action item is adoption of resolution 26-02, which is a request to the Washington State Legislature to maintain public health services funding. And so I think for this, we'll just start off, kind of do things slightly out of order just because it's relevant, and have Kim give a financial update and just maybe speak to cost impacts in advance of us taking this resolution up.
Thank you, Chair. Yes, in relation to Resolution 26-02, it seemed appropriate to present a little bit on, is it
Oh,
on?
is there-
Or am I just, okay,
Everybody can
thank
hear?
you.
Okay.
It seemed appropriate to give you an update on FPHS prior to consideration of this resolution. So today I was on a call with Wasalfo Executive Leadership Committee meeting, and we had some updates, and I wanted to share those today. And I have one slide to share, which is also in your packet. But essentially on December 23rd, the governor released his proposed budget related to the federal fiscal year 27 that begins July of 26. And that's considered an all cuts budget. So there was no new revenue stream, funding streams considered, at least for the federal fiscal year 27. That budget is subject to edits, so it is just proposed at this point. However, the House and the Senate are working through their budgets, and we'll have a proposal anticipated by late February. So there's some advocacy and education that can happen between now and then. And then finally, looking for the final budget to be negotiated by March 12th, which brings us to kind of where we are today. So just some highlights of what's in the governor's budget, specific to FPHS funding. This slide is also in your packet. This was shared this morning, so I apologize you hadn't seen it prior. But specifically with FPHS funding, for the federal fiscal year 26 that we're in today, we have taken already a $12 million reduction across the system, and those impacts are already felt across the board. But what's presented in the governor's budget is a projected vape tax deficit towards that fund. The revenue is redirected, and so that's at 21 million essentially. There's approximately 4 bills that are currently out trying to address the shortfall, so we don't know how they'll end up. Wasalfo is monitoring those very closely and trying to take the pieces of each of those bills that are advantageous to the FPHS system and put together one proposal document in a package that they could help share to support in what a final proposal would look like. So pieces of each of those particular bills. So that's part of the topic, is the 21 million shortfall. In addition, FPHS reductions in the governor's budget is 29.1 million. So essentially $50 million is the potential in the 2026 fiscal year, or 2027 fiscal year rather, starting July of 26. So this slide does show an overall reduction for the federal fiscal year 25 through 27 of almost 40%. Which brings us today to why we have a resolution in front of you today. Across the state, Wasalfo's been working with all of LHJs to help educate and give us some tools and resources. to bring to our board for support. And so bringing forth this resolution today is to help support maintaining federal foundational public health services. And there's also letters of support if a resolution is not appropriate in any particular area across the state. But it is, they're compiling for WSALFO, showing the support across the state to maintain FPHS and educating how important that is. Specifically to the health district, which is within the resolution, federal fiscal year 26 is currently at 5,886,000 for this organization. If according to the governor's budget, which is rolling back to 2023 levels, that can be an upwards of $2 million cut to just the health district specifically. So they're using somewhat of the last in, first out approach, or essentially looking at when FPHS expanded, which was in 23, it's expanded significantly, and rolling it back to those levels. So that's where some of those numbers are coming from. Additionally, before, with the current federal year that we're in that ends in June of 26, we also have the challenge of a known $3.5 million deficit. That the number is not exactly known, between $3.5 to $4 million, that we have to, as LHJs across this state, come up with a process on how those reductions will be made and in what areas. So I have been asked to participate in that as a representative of the health district and on the east side of the state, as well as a large LHJ. So there's a committee of two small, or work group of two small LHJs, 4 mid, and 2 large. So we're starting as early as Tuesday to work through decision making as far as what we would have as a proposal for the late February ELK meeting for discussion and everyone to approve. Essentially, a larger group, we're not making as much headway. So the work group is now the next step, because there's going to be hard cuts in lots of areas, and so it's how to help prioritize. So that's happening. And then just really wanted to emphasize again support for the resolution and maintaining FPHS is what's bringing it forth, and appreciate you all. Thank you to Commissioner Waldruff helping us get this on the agenda quickly, so that we can start advocating in this time frame before the House and the Senate budgets come out at the end of February. And I'll turn it over to Commissioner Waldruff if she has anything else to add. She's been in dialogue as well.
Yeah, I think if it was just the 29 million, that would be, that was in the governor's budget, obviously it would be alarming, but maybe something we could work through. But as I understand, anyway, it's this whole vape tax thing is very complicated, but Jamie Bodden from WSALFO was trying to explain it to me. I don't even know if I still understand it, but I guess unintentionally the legislature changed something around vapor tax at the end of the session last year. And so I don't think it was meant to happen, but they redefined it as a tobacco related tax, and then all the money was swiped to other things,
to state general fund, I believe,
not to foundational public health. So it was not known, it was not intended, and then by the time they figured it out, the account is gone. And so that happened, and so that makes this deficit really, really alarming and scary. And but you were saying, Kim, that it could be up to, so you're trying to work through a $4 million change from the federal level across the state, right? Across the state.
Across the LHJ specific.
Right,
So not
right.
the full system, just the
Right.
LHJs. And that's just for the January through June of
But
26.
this would be potentially,
Oh yeah, that's just the state portion of FPHS.
Right.
Correct.
but this could potentially be, I think you put in the resolution here, a $2 million cut. If this were to go through just like this, which we're hoping the legislature makes adjustments, but if it were to go through like this, it'd be, is it
It's
2 million or
almost 2
more?
million.
Almost 2 million.
Depending on the interpretation of federal fiscal year 23, and we did get some additional, they had a one-time FPHS ask, so we went and asked for additional more, a little bit of more, or was it on the base that we received?
So around 2 million,
Mhm.
we'd have to adjust our budget this year.
Mhm.
but that would be for the calendar year 26 to 27.
Correct, July through June.
So, I mean, that would be a major hit to us. So anyway, so when Jamie emailed this to myself and Commissioner CUNY, we jumped on it, and we're actually considering a county commissioner resolution as well, because these dollars, really, we need the state to step up and not put it all on local jurisdictions. So anyway, it seems very concerning, and so thank you to the staff for putting this together and getting in the packet for us to consider today. Normally, it would go through the policy committee and then come before us, but the session is moving really, really quickly, and we won't have another board meeting until the 12th and then the end of the month, and so just wanted to get it before us. So basically, it just talks about foundational public health. It talks about how much gets allocated to the health district, what the cut to the health district would look like, and it just asks that the state legislature recognize that this is an essential service, maintain the service funding, fix the vapor tax errors. So we don't say how, but we say fix the errors, and allow us to continue to receive the funding that we intended to receive. So that's the gist of the resolution.
Commissioner?
Can I ask, this is the first I've heard about a vape tax error. I saw it in the resolution, and I was going to ask, what is it? And I think you did a good job explaining. Is this well known by the legislators that this is a problem? Or is this probably just the people that are on the healthcare committee understand that? I mean, 'cause I haven't heard any legislators mention this when I've talked to any of them.
I think it became aware this fall when someone was looking at the accounts and going, wait a minute, why are we so low? And it had to do with some sort of redefining of vapor tax that was, I guess, unintentional and nobody caught it. But that's how I understand it. So now they have to go back and fix it. But I guess it's always been put, the vapor tax, a significant portion has always been put to public health, FPHS. And this was, is that
Couple
true?
years ago, I think it wasn't always
in
from
the last
inception,
couple years.
but
Well,
they
I
found a
guess
funding
maybe
stream.
a
So-
more important question, is there a legislator that is carrying the ball on getting a fix? Is somebody championing
Sounds like
fixing
there's four
this?
different bills, but
Okay.
who
And do
knows
we have,
what has legs? I don't know.
okay. Is that, are those
It-
on this list somewhere?
It's not on that list. I
You're not sure? Okay.
apologize. I wrote down, there was one particular champion for
Okay.
fixing
So
this.
someone
And there's
is
3
working
others that are
on
working with it,
though.
yeah. And I don't have
Okay,
it in my
'cause that-
notes, but I could share that
Okay.
via email to everyone.
So not only were the dollars redirected, but they were clearly spent, at least before somebody could notice the error and maybe somehow hit pause on that. But yeah, it's got to get corrected, I guess. And certainly this is all consistent with I think our state legislative agenda, which calls out funding for these services. And so I think this makes a ton of sense to
I
move
think I
forward.
can see, if you look on high priority bills,
Is it on there?
there's 2 House bills and 2 Senate bills that mention vapor products or cigarette nicotine taxes. So I think there's 2 on the House side, and 2 on the Senate side. House Bill 2382, House Bill 2439. So that must be what you mean by the 4 different bills.
Yes.
And then on the Senate Bill 6116 and 6129. So Braun, Robinson are the senators on those, and Reeves and partially on the House. But we can look and see others who have.
Yes, thank you. I think it's Robinson most closely aligns, I think,
Okay.
with what our needs are, but Ms. Alpha was gonna coordinate, pieces from each of the bills and put together the one document that would be in support. And try to get that message out as the package.
Do we know when the policy cutoff is, Commissioner Kearns, for the legislature for bills to pass out of committee?
It's February
I
4th.
thought it was did you say third?
I think it's the 4th. I thought it
Oh,
was
see,
the
I
4th.
was thinking second or third,
Yeah.
but I mean, it's right at the beginning of
Yeah.
February. Okay, I was thinking second or third. It might be the 4th,
Somewhere,
but
yeah.
it's next week.
Yeah,
So-
coming up fast. So I
But
was
that's
gonna.
policy, not NTIB bills, though.
Right,
And I think these would probably fall under
Okay.
necessary to implement the budget.
Right. Okay.
So,
I was just thinking if we at the county might be able to get our lobbyist on it too, because I would be concerned if this doesn't get fixed it impacts the demands that local jurisdictions would be requested to help. So
Okay. Are there any other questions, comments? Is there a motion to adopt the resolution?
I move to adopt the resolution as written. I think it's very important to support our funding source.
Great. Thank you, Dr. Blankowski.
I'll,
May.
I'll second the motion.
Okay, motion and a second. Any further comment? Seeing none, all in favor of the motion, say aye.
Aye.
Any opposed? Abstaining? Okay, that motion carries. And I will just say, I've got the calendar here. Feb 4 is policy cutoff. Feb 9 is fiscal cutoff. And then February 17 is House of Origin cutoff.
thank you.
And if I may just add one piece,
Yeah.
we're monitoring, of course, the government shutdown potential. Tomorrow is the deadline for the continuing resolution. So just want to let you know, we do have contracts in place for WIC funding. And so we don't see that as a significant impact like we had last time, but are certainly monitoring it closely.
Okay, thank you so much. And Kim, if you've got other finance numbers to share as part of your report, do you want to go ahead and just do that
Sure.
now?
Yeah, real quickly.
We're moving into reports.
Typically December, or in January, I don't report December numbers because we're still calculating those. So as an agency overall, those numbers aren't yet available.
Okay.
However, treatment services has numbers in in the packet, and we're able to show what we've billed to date. So you have a pretty good sense of treatment services ending for the year. It does have a surplus overall. And then just the other piece, I'll next month, I will give an update as soon as I have 2025 closed. And it's subject to those grant billings. So
All right,
that's really all I have at this time.
great. Thank you so very much. Appreciate that, Mr. Commissioner.
So if treatment services had a it looks like they're gonna end with a surplus, which is great. Does that mean that they didn't need to dip into the reserves that we had put aside for the
Correct.
expansion? So they're just using their current
At this time,
cash flow
yes.
for that?
Yes.
Okay.
So that reserve will just sit there for going into 26 until such a time. If
Right, because there
needed.
will be obviously increased staffing and costs this year because you were just getting people on board at the end of
Yes.
last year. Okay,
And I believe Ray has an update for
okay,
for
great.
everyone.
Well, and with that, we can head to our administrative officer's report.
Thank you.
So just two quick things. One, as far as the legislative report, we will be pulling the WASAFL update on Monday morning, getting that to Ann, and she will forward that to the board each Monday. So, and then if there's additional questions, if you want to send them back to us, we can certainly seek the answers for those. And then the second piece is just a quick update on treatment services. So we are fully staffed now, and we will be moving to expansion hours as of February 21st. So just a recap of those hours, Monday through Friday, we will be open 5:15 a.m. to 5:15 p.m. for dosing, 6 a.m. to 5:15 for office hours. And then on Saturday, we will be open 7:15 to 2:15 for dosing and office hours. And then just a quick note also that these hours will allow for assessments to be done 6 days per week and until 4 p.m. Monday through Friday. So we are seeing the expansion of the assessments there, which was really the key that the board was asking for. Yes. So,
Sure.
so the treatment services will be open a little bit on either end just for staffing, getting preparation for dosing, and then a little bit to close the day out.
Are there any plans around communications to get the word out about that?
Yeah, so our communications department has been working with them. They've already got stuff out. We posted the doors. And they're working with community partners to get that out, as well as messaging to current clients and that too. So yeah, there is a campaign to get that out.
Do we think there, like a press release situation might be a good idea? I feel
Could
like
be.
it could be a news story that this is an expansion, just given everything that the public is concerned about with opioids and fentanyl and other things, so.
Changes look like.
Yeah, we can, I'll work with Kelly on that.
Yeah, I think that's a really good point, especially now everybody is feeling so much constriction in public services on all realms to actually be able to say to the community, you're expanding something, some access. I think that's an important message.
Yeah, I think it could get some earned media. You know, I think the news channels would cover it and be interested in, and you know, spreading the word. And I know there's an community outreach person, I believe, that we've heard about that was hired to kind of go and make connections with partners. And so I'm assuming that would be their number one job, is to let all the partners know that are out doing street outreach, that are out in the community at different social service agencies, letting them know, hey, you can come in for an assessment, you know, all day. It's not restricted. So it's exciting.
Yeah, so it's been a long process to get fully staffed for that. So now we are, the trainings happen. So that's why we're getting ready for on the 21st. So
Great.
yes, and
All
I'll
right.
work with Kelly on that. And that's all I had for an update.
Awesome. Any other questions? Not, yes.
I just wanted to clarify, Kim, so the WIC program is, if I remember, in the last negotiation at the end of last year, even though that the Health and Human Services funding has not been passed by the Senate yet, the WIC funding, though, was extended all the way till like September of this year, as well as I think SNAP too. So those two things are not going to be at issue with a shutdown. Okay, thank you.
Okay, and we don't have a legislative report this month, but if there are questions on any of the bills or what's happening, you know, those can be directed probably to Ray, and we can get some answers back on those. And then hopefully next month we can get just a little bit more of an update at that board meeting. Health Officer, Dr. Velasquez.
So good afternoon, everyone. So I have a brief presentation today. I'm sure everybody's disappointed that I don't have my usual 37 slides, but we were supposed to have a quality of life survey, but it has been scheduled for February. So I kept mine very brief, but I'm happy to talk for a while about anything else. So welcome to our WSU nursing students. And I told them that there will be questions after the presentation for the exam. And I know that we have some soccer fans in the audience too. So with that, let's move on. I have a couple of things to talk about. Obviously, things that we're tracking like measles and flu. And I think we all know someone that has had the flu, the bad cold, or something related, because respiratory illness is floating all over the place. And then I'm going to give you just a brief update of some of the preparedness in anticipation of activities that may be related to the FIFA Cup, because we're always preparing for anything and everything that comes. So before we do that, this month is National Blood Volunteer Donor Month. I underscore volunteer because they are paid blood donors too, and we appreciate their service, but this is specifically to thank our volunteer blood donors. And as you know, this is a component that we cannot make. We can only obtain by donation, and this goes back to the first of my 7 careers, because I started as a blood banker. And I used to run transfusion and donor services for Boston University Medical Center. That was my first real job as associate medical director. So I do have a soft spot for that. But the reality of the matter, in our region, we do have a shortage, and our healthcare providers will really appreciate it if you can donate. Remember, you can donate whole blood. You can also donate platelets by apheresis. They're both great, and every single pint of blood can be broken down in 3 components at least, and sometimes in a few more. So you can save 3 lives with just 1 donation, just to put it that way. Going back to like my early days, my leukemia patients did require a lot of blood products, so I was always very grateful for for this. So heads up, and if you haven't, there's still time until the end of the month, which is a couple of days away from now. Okay. So let's talk a little bit about measles. As you know, we have seen a number of cases all over the country, and we have heard about outbreaks in various parts of the country. If you look at the darker blue, that's South Carolina, which was recently in the news. There's a tie-in to Washington, as some of us have seen because of travel. But the reality is that we still have cases floating around, and we still need to be mindful of that. Now, the good news is we have been working very diligently with our healthcare partners because there's post-exposure prophylaxis, a number of things that we can do. And there is, the more that the community knows in terms of signs and symptoms, you can see them on our website, as well as where we have higher cases around the country. If you're going to travel, talk to your provider about what to be mindful of when you come back. And if you go to any healthcare facility in the county, you will see if you have a rash, call your provider, don't come in. So good news. I've had a lot of time to visit our healthcare facilities in the last couple of weeks for unrelated reasons. So I've seen all of the signs. But basically, this is where we are around the country. We've got about 416 total cases. As you can tell by the graph, we had a significant uptick in the recent past. And the spread in terms of age groups is pretty typical. There's nothing unusual there. And unfortunately, as you know, measles is not just a rash. It can be have significant sequelae as well as more complications depending on your health and age. So it's not something to be taken lightly because it's not just a little bit of a rash. It could be quite significant. And we've seen a number of patients in the hospitals, about 2% of the cases thus far, which for a viral infection is a significant number. Now, when you look at where whoa, that was supposed to look better, but anyway. So you have the history here. We went back to what we heard about Snohomish County, which has been on the news. And so you will know we have been part of that response. And we had 2 or 3 calls a week. I can't remember if it's 2 or 3 for the whole state, just to make sure that we all hear the same thing because of travel and movement and the fact that people have moved around the state, including around here. Now, when you look at the state of Washington, that is from last week, because I have to put the slides together like a week ahead of time or 10 days. Now we have a total of 8 cases as opposed to 6. And it's 3 under the 5, 3 under the 5 to 6, 17, and 2 on the 18 plus, and that was related to this outbreak in Snohomish County and other parts of the state. So we're anticipating that we may see more, but I do have to say all of our regional partners are engaged. We are fortunate in Spokane County, and I want to give a shout out to the team upstairs that we have very cohesive response between our epidemiologists, immunizations, emergency preparedness and response, and communications, which is has been seen as a good example across the state of how to do these things. And as I've highlighted to you before, our responses have been quite assertive and quite effective on the issues that we have seen. We had an interaction with our partners in healthcare, and the team here got a lot of kudos for their work and diligence. There's always opportunities for improvement, so typically on the communication side. So we got a couple of suggestions, but overall, really, really, really positive. And I think it's just to highlight the effectiveness of the teams that we don't see them, but they're up there or in the community doing what they do and protecting us from all of this, because this could have been a lot worse for everybody. So kudos to them. So with that, let's talk a little bit about what's in a lot of people's minds or noses, which is respiratory illness season. As you know, we're in the thick of it, and I know it doesn't look like winter, but still the viruses are here. And this is if you look around the country. It's kind of a nice graph, and again, it's a week old, but it basically looks at emergency room visits based on activity of the various viruses. So when you look at the threshold, it takes you is elevated, and you go like, oh, what does that mean? Well, the reality of the matter is that the bulk of that elevation is due to our friend the flu, which is not uncommon for this time of the year. We still have COVID, we still have RSV, we still have common cold. There's a lot of common cold. There's actually some common cold that seems to be pretty significant. I see lots of people with sniffles, but they don't have the flu or RSV or COVID-19. But the flu is still here. And as you know, bless you, at this point in time. But that was a very good example of how to, sneeze and very good. So we should have filmed that. But that's important because that's how it gets transmitted. But as you know, at this point in time, the quote unquote, the variant, the subclade K, which is H3 and 2, is the predominant subtype of the flu that is floating around the country, which is something that we saw at the beginning of the Southern Hemisphere flu season with Australia. That's the first time we saw it. Anyway, if you look at the percent of emergency department visits statewide, and I'm coming to the state of Washington, it's kind of plateaued a little bit, which is good. But if you go to any of our healthcare facilities, they're very busy. So this is where I tell people, do a little bit of an assessment of your symptoms before you run into the emergency room. There are other ways to address respiratory illness if it's not critical, significant, or severe symptomatology. You can do that by messaging your physician. You can have a telehealth visit. You can go to the urgent center. You don't have to run into the emergency room. Let's leave the emergency rooms for the cases that are more complicated and those that need it. Because if you have the flu or a bad cold, can be managed without going to the emergency room. But the good news is we are plateauing, and if you look across the country, we're in a little bit of a downward trend in terms of total cases, although there was an uptick on emergency room visits, which translates into we're seeing more severity, which goes along with a subclade K, which tends to be a little bit more severe than the other strains of the virus that we were seeing. So everything ties in very neatly. And this is where we are locally. I will encourage everyone to go to our respiratory illness dashboard, which is a great dashboard, which is being replicated by others. We should have patented that. No, you can't do that, but kudos to the team upstairs that has been working on dashboards for communicable disease, a great way to show. And as you can tell, we kind of had a peak, and now we're on this little downward trend, which mimics the rest of the country, but the number of cases is still elevated above what we will call, the threshold of disease. So still to be mindful, vaccine, if you can get your shot. I know I always say 2 weeks before Halloween so you can go trick or treating, but if you didn't get it, we still have a couple of months of respiratory illness season, so there's still time to get your flu shot. And remember, the flu shot is effectiveness between 30-60%, depending on the year. This year is floating in the high 50s, and what that basically means is that's really good at protecting us from having to go to a doctor, emergency room visit, or very severe illness. So it's still worth taking the shot if you haven't. As always, speak to your provider. Your provider knows you the best, and they will be able to advise you on the best course of action for you. And the last thing I have for you is our team in emergency preparedness and the rest of the SRHD team. We're always on the alert and making sure that we're aware and prepared for anything that may be in the horizon, whatever that may be. And as you know, there's a lot of conversations about the World Cup, which includes us, if you look at the map, because GU was approved as one of the quote-unquote potential sites. We don't know that we're going to have or not, but we do know we're going to have a couple of fan events. I'm going to talk about those. And the reason why we're tracking this is because we need to anticipate everything from air quality to communicable disease and everything in between. So we've been already engaging and are calling a regional formal meeting with all of our partners to make sure that we're all on task. And the reason why I bring this up is because we do a lot of this, but we do it quietly many times. And I think it's important for the community to know that doesn't matter what it is, we're always anticipating, we're always ready to provide additional information or assistance as needed. So these are some of the things we know. We do know, and I'm not going to go through all of this, but we do know that we have two what they call fan zone events, June 19th and July the 19th at the pavilion. So we'll be preparing for those in collaboration with our partners in healthcare, emergency management, fire, police, et cetera, just to make sure we're all good. And if indeed Gonzaga is accepted as a base camp, we'll work with our partners at GU, whom we work all the time, and our partners are Northern Quest, because that will be one of the potential places to stay for guests and others. Now, we don't know the size impact of this yet, because we don't know exactly what we're going to look like. But regardless, we're going to, we have started the preparations a while ago, and we'll continue following the checklist of everything we need to do to make sure we are ready for any potential eventuality, although we would prefer that nothing happens, but there's a lot of things you cannot predict, including the weather. So that was the extent of my update today. Short, sweet, and to the point. I think it's a record. No, actually, I think a record was 3 minutes on one that I basically didn't even get up. Any questions about any of these issues?
Thanks, Dr. V. Is there any comments, questions? I am not seeing or hearing any. Okay.
Can I make a comment? And
Yeah.
thank you to Commissioner Jordan for the mentioning the navigators, which the positions are posted, they close. And we have a number of candidates for the navigators, which we're going to start interviewing next week. And then we're going to deploy them in the community to work with all of our community partners on the potential installation of these filters. There was a large community meeting Monday night where we talked about this and a number of other things. So thank you to our partners in the county for providing the funding for those, because as you have seen from Kim's presentations, we don't have anything to squeak by. So, but that's important to the community, so we appreciate that. Any other questions? Yes, ma'am.
Yeah, I just had a question. Is there anything you think that we could or should be doing to boost our measles vaccination rates?
Yeah, good question. So we have our immunization team has been actively participating in a lot of community activities, a lot of press, a lot of communication. We have engaged with all our healthcare providers, as well as all of our partners that may be in a position to help with that, including K through 12 and higher education. So all of that is happening, and it's all about providing the information, the awareness, and the access. We may not have the vaccines, but we certainly can point people to where they can go to get the appropriate immunizations, whether it was MMR or anything else. We've had a couple of clinics too, because of some of the proximity of the outbreaks, et cetera, et cetera, et cetera. So we continue to engage on that, and I'm sure we'll have another Facebook Live on that coming up. I think we did one on the flu, and there's another one coming. Good point.
Commissioner?
Following up on that, are we seeing trends in those vaccination rates in the county?
Sure. Eastern Washington and Spokane have typically been on the slightly lower side of the state. We continue to be in the slightly lower side with a slight dip. And that dip started a couple of years ago. So back to the question, I think there are a lot of questions about the why or why not, and when not. And one of the things we've been doing is trying to clarify all of that, because there is some confusion. So we have, we're recommending that people, if you have a child, talk to your pediatrician or family provider that will be able to guide you the best way possible. If you're an adult, to your primary care provider. or go to our website because we do have, this is what you need to be following. That is very clear for anyone that has any questions, because it's a little bit confusing now because there've been a lot of realignments and changes, and confuses people. So our job is to make sure that people have the accurate information. So we've gone a long ways to provide that, and we'll continue to do that. But the trends are not, we've been on the lower side and continue to be on the lower side in pockets. It's not 100%. There's some that are higher, there's some that are lower, and that's not uncommon for vaccines. Good question.
So if any board member wanted to kind of see that over time, is it the Department of Health would be the best source for that, or is there a
So
different source?
we track ours, and we actually even have immunization percentage and raised by school district,
Okay.
because that's that's kind of like a target age group. We track all of that, and we do meet with our schools individually to go over it. And again, this is not punitive. This is more like information. Let's talk about this. How can we help you? And here are the resources. So we do spend a lot of time doing that. We have all of those, and happy to share those.
Thank you.
And I can actually bring that on one of the next updates a little bit, because I think last time I showed that was over a year ago, with probably about the same time of the year last year. But that's a good point, because it is important information. And, parents or guardians always want to do the best thing for the kids. So, sometimes not knowing what to do is the issue. So we try to help as much as we can. Good question.
Thank you.
Okay, thank you so much, Dr. Velasquez. Appreciate that.
Thank you.
We do not have an agency presentation or report this month, so that brings us to our board member check-in. Is there anything anybody has for the good of the order to share, comments, thoughts? Anybody at all, online or in person? Not?
Mr. Chair.
Yes,
Oh.
Commissioner?
I just wanted to note that I'm going to be going to DC in third week of February, and I'll be participating in 3 different activities that all line up. But the relevant activity to the Board of Health is the NALBO, National Association of Boards of Health, annual kind of legislative meeting. And we go and lobby. I did this last year, and we go and lobby with NACHO, the National Association of County Health Officials. And so I'll be going. So Wasalfo will be there, and other folks from across the state to advocate on legislative issues. So I will bring copies of this. And at the same time, it's also the National Counties Association meeting just previous. And so I'll be able to touch base with other counties in Washington State as well about some of those federal key issues like SAMHSA funding for behavioral health. So this is a lot of what's on our agenda is also on the state WASAC, the Washington State Association of Counties, as well as the National Association of Counties agenda. Because obviously most counties play a strong role in either public health delivery or behavioral health funding that flows through. So it'll be a whole week of lots of N organizations in DC. And so just want to let folks know about that, and hoping to learn more while we're there.
Very good. Okay, thank you, Commissioner Waldriff. Charlie?
I think I jumped the gun the last month or so. I don't know what it was, but just want to let you guys know that I have decided to not be part of the board. I think 4 years has been enough, and I think it's time for a new face and some more ideas to come to the table. So I appreciate everybody on this board. Thank you so much for allowing me to serve on this board. And I will try my hardest to be there on the 12th of February.
Yep.
To
Very good.
help interview.
Awesome. And thank you so much for your service on this board.
Absolutely.
It's been great to work with you. All right, I am not seeing anything else, so we are, and there's no more citizen input, so we are at our conclusion. It's kind of nice that we get done early on the day that we extend our meetings, but I'll take it. So That's right. So with that, I'll call the meeting adjourned.